Computer. Okay, so due to popular demand, I am making this video to try to help you guys take the information that I'm giving you and understand what it is that you need to focus on, okay? So I'm gonna try to give you the tools that you need. I'm gonna share my screen and we're gonna do this step by step. Ready? Well, ready or not, here I go, okay? So the first thing that I'm gonna do is I'm gonna share my screen and we're gonna go into teams, like making believe that I'm the student, right? And I am saying to myself, well, let's see, what is it that I need to look at? Let me go to Teams and let me go to Pharmacology and let me go to Files and let me see, oh, so Miss Mary has put up a PowerPoint and the PowerPoint is chapter 15, okay? So I click on the PowerPoint and it opens, but we're not done there. Because in order for you to see everything that I need for you to see, you need to download the PowerPoint. How do you do that? You might ask. Let me show you. Okay. So when you open up the PowerPoint, up here, see those three little dots? That's called an ellipsis. When you click on it, opens up a window, and you're going to click the button that says download, and it's going to begin to download the PowerPoint, okay, onto your device. Now I have a Windows operating system, so down here is the PowerPoint, okay? Excuse me. And so when I click on it here, or if you have an Apple, with Apple you can go up to the top right and there's a little red arrow, okay? I'm going to click on it, and when I do, it's going to open up the downloaded PowerPoint on your device, okay? So it's opening up right now. So you're going to look at the PowerPoint, and the PowerPoint, I have highlighted the things that are important. So for example, here, this is the opioid PowerPoint. The very first page, must know meds. So these are the meds that you have to know. But with the opioids, they all act alike. You have morphine sulfate, which is fast acting, codeine, Demerol, meperidine, hydromorphone. You can read, right? So I tell you, here are the meds that you have to know. And then the next page, I talk about, like, fentanyl is the one oddball. Why? Well, I'm talking about the patch. And I give you right here, highlighted in yellow, what you need to know. It's slow acting. Make sure you have a PRN while you're waiting. Place on skin with the least amount of hair. Don't shave the hair. Put it on a fatty area. Change every 3 days. Initial and date. So when you see this highlighted, and while you're looking at this, you're listening to my lecture, watching my video, you know I have to know this, right? I have to know this about fentanyl, right? And I mean, I'm making it as easy as I can, right? Talk about opioids. What do they do, right? All this stuff, yeah, but here's what's important. They treat pain by blocking the receptors in the brain, okay? So that's how they act. If I don't have it highlighted, then it's not that important, right? So here, opioid, their uses, indications, treat pain, highlighted, okay? Adverse reactions, highlighted. Sedation, increased intracranial pressure, depressed breathing rate, depth, right? That's depressed respirations, paralytic ileus, urinary retention, and I do have constipation. But so you see that those are the ones that you need to focus on, because you're not going to remember all of them. And like I said, allergic reactions, every single drug can cause an allergic reaction, right? So the things that I've highlighted are the things that you need to say, all right, this is what I need to know. And if you're watching the video while you're looking at this, I say in the video lecture, respiratory depression, urinary retention, paralytic ileus, they're the 3 biggies. I say it. You need to know that. So it means you need to know it, right? Contraindications. Who would I not give the drug to? Yeah, these things, but look, see how these 2 are highlighted? If they have asthma, emphysema, airway obstruction, a head injury, and those are big ones. Know them. for contraindication. So you should be writing this on your template, right? It just makes sense. I'm giving you the information, right? Precautions, be careful giving it to old people. Patients considered opioid naive, and I explain that in the lecture. People who've never had opioids before, right? And I go in and talk about these things and why. Undiagnosed abdominal pain, hypoxia, not enough oxygen, prostatic hypertrophy, because they're retaining urine, and opioids will make them retain more urine. And I explain it all in the video. So the things that are highlighted are the things that you need to know. So when you see these other pages, right? Ongoing assessment, yeah, vital signs, but respiratory rate, see how that one's highlighted? I mean, if you just focus on the things that I have highlighted, you shouldn't have any issues, right? When I talk about the PCA pump, right? And how it works so that they can't overdose. And I talk about that in the video, right? I talk about, again, the nursing process implementation, long-acting forms of the meds. You're going to need something fast-acting for breakthrough pain. Obviously, that's important. So I basically am giving you the highlights of the things that are important. So you can't know everything, but the things that, like implementation for the nursing process, how do you monitor the drug? If their respiratory rate's 10 or less, whoa, right? That's a problem. Stop the drug. If their pulse changes or if their blood pressure goes down, right? So I'm telling you what you need to know, and here are the nursing diagnoses associated with that. So this part of it, I guess it seemed to me to be pretty straightforward. So if you were doing a medication template, okay, let's say you're going to do morphine. Well, so you watch my video and look at my PowerPoint, and now you know those are the things to focus on. So then you go to good old Google, right? Good old Google. And you're going to go to Google, and the search bar, you're going to write in morphine, followed by nursing implications. And you're going to get a lot of results, but the only one that you're looking at is the one that says Davis Plus, fadavis.com, PDF, because that's the actual drug guide. So then you're going to click on it, and it's going to give you the page in the drug book that's the most current. So here we are. So now, based on what I lectured on, when you look at this, you go, all right, it's used for severe pain. I already talked about that. Don't worry about the action or the pharmacokinetics, right? We're not concerned with those things, right? Contraindications and precautions, okay? Look at all of that. Can you know all of that? You cannot. But the things that I talked about, right? Contraindicated for somebody with significant respiratory depression, bronchial asthma, right? Paralytic ileus, head trauma, increased interest. So the things that I talk about are the things out of the drug book that you need to know. You don't need to write all of that. You won't remember all of that, but you should be able to remember those specific things, okay? Then you go down, say, all right, what are the adverse reactions or side effects? Okay? Some of these things are underlined. Some of them are in all caps. They're shouting at you. Confusion, sedation, important. But look at this, all caps. Respiratory depression, right? All caps. That's important to know, right? Because I talked about that. And then I also talked about, the paralytic ileus. Urinary retention is not in all caps, but you need to know it, okay? So I'm giving you the information that in the PowerPoint and the video that you need to know, right? When you go down here, nursing implications, which are nursing interventions, okay? There are a lot of them, okay? So remember the things I talked about, for example, right here, sustained release, which is long acting, they need a short acting for breakthrough pain. That's the thing I want you to know. So write that thing in your template, right? Assessing the level of consciousness. If the respiratory rate's less than 10, that's the thing I want you to know. Write that thing that I talked about in the PowerPoint that you also see in the drug book on your template. Okay? I want to make sure that I'm making this as clear as possible. Okay? And then patient education. Let's see, implementation, patient family teaching. There we go. So instruct them how to ask for it, of course, right? It can cause drowsiness or dizziness, right? Change position slowly. Don't drink alcohol, okay? Have them deep breathe so they don't get a problem with their lungs, right? These are the things that you want to teach the patient about. Emphasize aggressive prevention of constipation, right? Because all opioids will constipate, but that's not going to kill them. You can teach them. They're talking about aggressive prevention, which would be fiber in the diet, increased fluids, and possibly a stool softener, right? So write that under patient education, the things I talk about. You can't write all of this, right? So this is the things I talk about, and the things that are highlighted are the ones that I know that you need to know, right? If I didn't talk about it in the lecture, don't worry about it, okay? And then the other thing, as far as what are we doing and when are we doing it? I'm back in teams now, okay? There's a lesson plan, okay? And the lesson plan is under files, and it's down usually towards the bottom because that's when the class started. And there you go. Pharm 1 lesson plan. When you click on it, it gives you week by week, week by week, week by week of what you're supposed to be doing, right? You can make it bigger. Oops. Click on the magnifying glass, 75%, there you go. And you can scroll, say, all right, what are we covering? Okay, week 5, that's today. We're supposed to be starting this, but we're not because I sent you guys a message that we're going to respiratory meds first, okay? And there was supposed to be a quiz today, but no, instead, you'll have the midterm next week, okay? And the midterm's going to cover these meds right there. There's your list, okay? Morphine, naloxone, fentanyl, aspirin, acetaminophen, meloxicam, celecoxib, ibuprofen, sumatriptan, okay? And then what other meds? Oh, acyclovir, ketoconazole, isoniazid, and rifampin. And then here, penicillin, trimethoprim sulfamethoxazole, cephalexin, tetracycline, metronidazole, vancomycin, and ciprofloxacin. There's your list. There's your list. I gave you the list. I told you what to focus on. And those are the things you write on the templates. Okay? It's that easy because the first step is what's the drug and what does it do and what are the side effects and what do you have to teach and what do you as a nurse have to do? That's memorization. Then once you have a group of drugs memorized, how do you answer questions? ATI. So now we're going to go to ATI. Log into ATI and we're going to do some practice. Okay? And I'm going to log in under the student view so that you can see it the way you would see it, not the way I see it as an instructor, okay? And there are 2 things. The practice in the adaptive quizzes is one, and then there are pharmacology flashcards in there as well that can help you with specific drugs, okay? So I'll show you what I mean. I'm giving you every possible tool that I can without physically just taking the test for you. So I'm going into the student view so you can see it the way you see it. Sometime today before I turn 60. There we go. And that's what your screen looks like. Ah, yes, I agree. Get rid of this. Now, so you have this screen. You're going to go to My ATI. And that's going to open up a new window. And then look at all the things that you have. Under Learn, you have Active Stack Pharmacology flashcards. Okay. If you click on where it says Modules, it's going to open up another window. And it's going to go through Body system by body system. Just the meds. Just the meds. So infection. Okay, let's take a look at infection and see what meds there are. Come on. Of course, today my computer's moving super slow. Wow. Refreshing the page. Well, that's not good. All right, let's try this. Doesn't want to load today. Okay. Here's pain. Let's try this one. Now, when you encounter an issue like this, right? If you should encounter an issue like this, you have to say to yourself, could there be an issue? I wonder if there's an issue with my settings. Oh, maybe not, it's just moving slow. Because it possibly could have been that you had pop-up blocker on or something here in settings. But no, it's just moving slow. So here you go. It gives you the instructions. Select the content. When you're ready, flip the card. It'll show you the answer. If you answer correctly, click yes. If you answer incorrectly, click no, because then it'll give you those same meds again. Okay? So, content focus. You can focus on adverse reactions. Okay? Let's do that. And let's start. What are the adverse drug reactions associated with aspirin and ibuprofen? GI bleed. Let's see if I'm right. Look at that. GI bleed, right? Gastric upset. Look at that. Salicylism with aspirin, right? So, but let's say I missed a few of them or I wasn't sure. I could always click no. And this way they can give me another one. What are the adverse drug reactions associated with celecoxib? Cardiac. Could I be right? Let's see, cardiovascular and cerebrovascular events. All of them cause this stuff, gastric upset and heartburn and stuff, right? Okay. Go to the next one. What are the adverse drug reactions associated with acetaminophen? Hepatotoxicity, liver damage, adverse reactions associated with tramadol. Tramadol is considered an opioid too. So, sedation, urinary retention, all those same things, confusion, right? Sedation, dizziness, respiratory depression, urinary retention. Look at that. The very things that I talk about, right? There's a lot. I don't talk about all of them, but the ones you need to know, okay? Let's see. Adverse drug reactions associated with morphine. Urinary retention, respiratory depression, sedation, constipation, paralytic ileus. Let's see. Look at that. Respiratory depression, sedation, constipation, urinary retention. How about that? Look at that. Okay. So these are the flashcards. Okay. And they can help you with very specific things. Now, if they're meds that I haven't talked about, don't worry about them. So we didn't talk about these, right? So just, who cares? Next, right? Naloxone. It's chapter 16. Adverse reactions with naloxone. Well, naloxone blocks the effects of opioids. So pain is a problem, right? Let's see what they say. Increased respiratory rate, which is really not a problem, okay? Don't worry about abstinence syndrome, hypertension, vomiting, and cramping, or ventricular arrhythmias. This one is kind of an oddball. You want an increased respiratory rate because if you're giving naloxone, they weren't breathing. They had overdosed. Makes sense? So there you go. Those are the active stack pharmacology flashcards. You have them, you can use them. What else do you have that you can use? Let's take a look. Okay, there we go. We're going to get out of this. And then if we go to test, see what we have here. Okay. Go down and go to Learning System 3.0. And this is where you access your adaptive quizzes. So there are two things. There are the adaptive quizzes, and then there are the standard quizzes too, right? Communication, fundamentals 1 and 2, gerontology, management, maternal newborn, cardiac, dermatological, endocrine, GI, immune and infectious, musculoskeletal. So let's just say we want to do musculoskeletal because we're preparing for the midterm for nursing 1. Go to musculoskeletal and let's take a look and see what the questions are and what can we learn. Nurses reinforcing teaching with a client who has osteomyelitis of an open wound on his heel. So the following information should the nurse include? You'll need to apply a cold pack to the site 3 times a day. Your provider might ask you to walk frequently to increase circulation. You'll need to limit consumption of high protein foods. Your provider might prescribe a central catheter line for long-term antibiotic therapy. That's the one I talk about in the video lecture. Maybe that's the one because Miss Mary said it. I don't know. Could it be? Let's see. Shut up. That's the right answer. And then there are some other explanations as to why the others are wrong. See? Nurse in an ambulatory clinic is caring for a client who has a facial trauma to the nose. Which of the following actions should the nurse take? First, determine the client's ability to take deep breaths, place a cold compress on the nasal area, palpate the nasal area for crepitation, offer the client an analgesic medication. You're going to probably do all of those things, but which one is the most important? So you're going to give them a med for the pain, right? You're going to palpate, but you always palpate last. You look, listen, feel, right? That's treating it. But determine. See, the key word there is determine, because you got to assess. Can they breathe? That's important before you do any of this stuff. Can they breathe? Look at that. Right answer. This just backs up what I lecture you on. Understand? These are the things that you have to be doing so you understand the line of questioning. Step 1, memorize. Step 2, answer questions under that topic, okay? And you should keep your med templates in a file folder on your computer so that you have them to reference because you're going to need them again, okay? All those medications that we've gone over starting at the beginning of this term, and every medication that's listed on that lesson plan, you need to know them forever, ever and ever, all right? So this is a starting point. Memorize. If you just listen to my lecture and look at my PowerPoints, the highlighted areas, memorize first, then you do the ATI, okay? Because if I talk about it in the lecture, guess what? You're going to see it again. Going to see it on your boards, okay? Now, I hope this little tidbit was helpful. I think this is a good starting point. So start with this. Do it like it's the way that I just showed you to do it. But step 1, you have to memorize. And memorizing is repetition, right? Why do I know all these meds the way I do? I say them all the time. I've been saying them for years. Think about it, okay? If you repeat something 7 times, your brain's going to remember it, okay? Other people have done this successfully, so can you. Deep breath. Okay. Go forth and prosper. All right, guys, I will talk to all of you later. I hope that this video helped a little bit. Let's see where we go from here. All right, and let me know. So if you need comments, concerns, questions, now you can go ahead and text, okay? All right. See you later, guys. All right. Bye.